This podcast is brought to you by Deepbridge Capital LLP. Deepbridge is authorised and regulated by the Financial Conduct Authority. Please note that investments discussed are both illiquid and high risk and won't be suitable for all investors and should be considered as part of a diversified portfolio. The content of this podcast should not be construed as financial or taxation advice. We recommend investors seek appropriate professional financial advice. Any views expressed may no longer be current and may have already been acted upon. Welcome to this latest Deepbridge Discovery Podcast. The purpose of this podcast is to bring to life the people and the companies behind what Deepbridge do. To that end, I'm delighted to be joined today by Jenny Bailey, who's CEO of Ferryx, a bio-life sciences company based in Bristol. So Jenny, thank you for joining us.
Thank you very much. Great to be here.
Brilliant. So with these things, it's always kind of makes sense to start at the beginning. So let's start at the beginning with Ferryx, and can you just tell us a bit about how Ferryx came to be?
Yeah, sure. So the idea behind Ferryx actually came from a chance conversation in a corridor around about 2009. Okay. So at the time I was working on inflammatory bowel disease, and my colleague and now co-founder Tristan Kogan is a microbiologist with an interest in all things bacteria and how bacteria interact with one another.
Excellent.
One day we got to chatting in the corridor about why don't probiotics work in people who have inflammatory bowel disease. And we came up with this hypothesis that it's due to high iron concentrations that are present in the lumen of the gut in people who have active inflammation.
Okay.
So when people have active inflammation, they can be bleeding into their gut. They can be stressed, and adrenaline, one of the stress hormones, can release iron into the gut as well.
Okay.
And often if they've got a long-term chronic gut condition, they can be on oral iron supplements. So all this leads to lots of iron washing around within the gut.
Okay.
Now, most of the bugs that are present in our gut can use that iron as a growth factor. So they all start to grow and multiply and take over. The species that are conventionally used as probiotics, things like lactobacilli and bifidobacteria, are actually quite unusual because they can't use that iron as a growth factor. So under those high iron conditions, when you've got active inflammation, they're outcompeted. They can't have a beneficial effect because they can't survive. So we came up with this idea, wouldn't it be great if we could find a probiotic that could survive in that environment and had anti-inflammatory properties?
Makes sense.
We had a little bit of spare time, a little bit of spare cash, and we thought, let's just see what we can do. And so this sort of started as an interesting side hustle.
That's where all the best ideas start, isn't it? Surely.
Absolutely. You know, we had our paid jobs that were keeping us going, but this is something that we were both really interested and really passionate about. And then, of course, we found something. And that's when we thought, okay, we need to do something about this. And
was that a eureka moment, as people often refer to it? Yeah, great.
Yeah, it was. I'd say rather a slow eureka moment, because we went through a series of steps before we decided that actually, yes, this is the thing that we've been looking for.
And was that kind of? Could you kind of sense the building excitement as things kind of happened? Yeah, brilliant.
Absolutely. And yeah, it was a really exciting time coming up with this, and then we sort of felt almost a responsibility that we've found this thing and it works. We need to get it out there into the hands of people who need it. And we looked at what the best way of doing that was. We were both employed by the University of Bristol at the time, and we decided that a University of Bristol spin-out company was the route to take, and so Ferryx was born.
Fantastic. So what was your background then within Bristol, etc.? So prior to the eureka moment, or whilst you were working on this?
Sure. So my background is in immunology. So most of my career has been spent in academia, working in immunology, specialising in inflammatory bowel disease. Okay. So I've got a PhD in gut immunology, and then worked as a postdoctoral researcher investigating inflammation in inflammatory bowel disease.
And I guess kind of gut issues and things like that are quite widely experienced by people.
Absolutely. I mean, the main focus is inflammatory bowel disease, and that affects 6.8 million people worldwide. Right. But there's also potential applications for this in people who have irritable bowel syndrome or IBS. So a lower grade inflammation, but still a very debilitating condition. And that affects about 15% of the global population. everybody knows someone who has IBS if they don't have it themselves. It's one of those things that's so common, but yet it can have a significant impact on people's life and their well-being.
So do you find people coming up to you and telling you all about their own issues? Is that kind of one of the pitfalls of what you do? Absolutely.
It is. But you know what? We're totally immune to all that now. If people want to come and tell me about their bowel troubles, then that's absolutely fine.
Well, we'll save that for one when we're not recording something. That's so kind of to date, obviously you've had your kind of eureka moments, if you like. Kind of what have been the key milestones or your key achievements so far?
Yeah, sure. So we had the eureka moment where we found that we've got this strain of bacteria that has what we call probiotic properties. It's anti-inflammatory. We've shown that it works in models of inflammatory bowel disease. We haven't given it to any people yet, but in models of the condition, it can reduce inflammatory signaling.
Yep.
So the first thing that we did was go to the university and say, we found this thing and it's great, but we don't quite know what to do about it. And they said, you need to patent it immediately.
Yep, brilliant. So, good advice.
Yeah, of course. So we went down that route. We've now got patents granted in Europe, including the UK, and in the US to protect our intellectual property. So I think that was our first key milestone when, first of all, we filed the patents and then subsequently got them granted. So
I guess that's when you feel like you've actually got something you can then build. Yeah. It's something tangible then.
Exactly. We've got a thing that could be really useful, really valuable to people. So that's great. Then
so what came after that? Sorry, I was going to say, what came after that? What was the next step?
Yeah, so we incorporated Ferryx in September 2019. Brilliant. And we looked then at our different sort of routes to market. So one of the great things about our product is it's got an amazing safety profile. So the FDA have designated it generally regarded as safe.
Okay.
In Europe, it's got qualified presumption of safety status. It's essentially a yogurt bacteria. It's as dangerous as eating a yogurt.
Okay, good. Can you get multiple flavors? No, that's
So
good.
A quick, easy, well, I say easy, maybe not so easy, but a quick route to market is a food supplement.
Mm-hmm. Yeah, absolutely.
So that was sort of the first thing that we're looking to do, is to develop a food supplement product. Again, I mentioned earlier, we felt like we had this responsibility to get this research out of the university labs and into people who it could benefit.
Absolutely.
And the quickest route of doing that is via a food supplement product.
So what's your kind of what's your timescale on that, or when do you want to have that in the market?
Due to be launched in a matter of weeks.
Excellent. That's what we.
So by the end of this year, people will be able to buy the product, which is now called Ferryx.
Okay, brilliant.
So we have been developing the branding on that product, developing the manufacturing on it, and so we are ready to launch pretty much.
That must be, again, a very exciting kind of point in your evolution.
So this is a real pivotal moment for us. And this has been enabled by the investment that we had from Deepbridge earlier this year. So it's allowed us to get to this point where all of a sudden we can have a tangible product in our hands, which, coming from that chance conversation in the corridor all those years ago to now having something in a box that we can give to people is incredible.
I mean, that kind of, it must be, I guess you're not quite there yet, but when that is going to market, you've got real life consumers using it. That will be, I guess, a huge moment for you, kind of 13 years after that initial conversation. Yeah,
exactly. So hugely exciting times for us. Yeah.
So over those 13 years, it's these things are never linear. They're never plain sailing throughout. It's we obviously see the challenges that early stage businesses go through, and particularly in the life sciences sector where you operate. So kind of what challenges have you faced, and what have been the key, drivers to overcoming those?
Yeah, sure. I mean, I think sort of a consistent challenge throughout the whole program has been funding. Yeah. In the early days when we first started this, 2009 doesn't seem that long ago, but actually there's been a huge shift in attitudes towards microbiome or bacteria-based products over that time. As consumers, many of us will now understand the importance of a healthy gut microbiome and how that impacts not just on your gut health, but on the health of your whole body as well. Yeah.
And also not just the bacterial kind of science and things, but economically, I mean, 2009, we were still in the grasp of the credit crunch. So, in terms of finding that funding would have been an interesting journey. But sorry, I cut you off there. You were talking about the change in microbiology.
Yeah, exactly. No, you're exactly right. And at that time, convincing people that a probiotic was something that was going to be really important in the future, it just wasn't that well accepted. It was always, it's interesting, but I can't see it's going to be that groundbreaking. Fast forward 13 years, and all of a sudden, microbiome-based products are a hot topic. It's something that everyone's interested in.
I was going to say, everyone's come around to your way of thinking. That's what it is. So, that's...
Yeah. So we're just ahead of the time, that's all.
Absolutely, of course. So in terms of so in those early days, did you get some grant funding? Was there kind of funding available to kind of help you get it off the ground in the early stage? And then obviously, we came in slightly later with your kind of seed stage, etc.
Yeah, so in the very early days, no, we struggled to get funding for this. So we did this as a side hustle using sort of slush money from bits of consultancy work and other things that we were doing. It was drip fed. It was doing little bits at a time with what we could afford to do. Once we started to be able to demonstrate and showed efficacy, then we were able to get some grant funding for that. And then, of course, we set up the company September 2019. We're just going out to look for investment when the world shut down in March 2020.
Yep. Perfect timing.
Absolutely. We had pitches lined up with investors. At that point, we were looking to angel investors, and we had pitches lined up that were cancelled because everyone just went underground because no one knew what was going to happen. It was such uncertain times. Everyone just hid away. So again, we had to pivot and look for alternative sources of funding. And what we did at that point was we were very fortuitous in that we were invited to do a KTN webinar.
Okay.
So again, in the very early days of the pandemic, as we were all still getting used to Zoom and webinars and all that kind of stuff.
Some of them still are, but we're getting there.
Yeah, so I was invited to do this KTN webinar. And I focused on sort of the human aspects, but we've always had an eye on the veterinary market, mostly because historically, although I've worked on human disease for most of my career, I've actually been based at the University of Bristol's vet school.
Okay. My
colleague Tristan Cogan has spent most of his life working on chickens.
Okay.
So he's done a lot of work looking at Salmonella and Campylobacter in chickens and how we can reduce carriage of those. It's a public health issue.
Yeah, absolutely.
So I threw in a slide in this webinar about, by the way, we've also got eyes on this could be veterinary application. We have actually previously given it to some neonatal calves on the dairy farm at the vet school and found that it significantly benefited them in the early life stages.
Okay.
So I just sort of threw in this slide on, by the way, we can do veterinary things as well. And on the back of that, I was contacted by AB Agri, who are a global animal healthcare provider, who were interested in this product in chickens. So all of a sudden, we pivoted into chickens. And we did some work with them, which brought in some revenue, which kept us going and allowed us to survive the pandemic.
Yep.
And then when we're ready to move forward again with our human work, we went back out for investment, and that's where we met Deepbridge.
Brilliant. I mean, that's so in this story, the chicken definitely came first then. So that's
absolutely.
Sorry, I couldn't resist that one. So have you, when kind of starting this, etc. Obviously, yourself and Tristan know this market well. Is there locally good skill sets for bringing new people in as and when you need them, etc. Is that a challenge, or is that something where you've got a good local skill set?
So we've been pretty well supported. I mean, as a University of Bristol spin-out company, we were introduced to contacts through them. Yep. And in fact, prior to us setting up the company, we did the Set Squared IQR program, Innovation Commercialization.
Which is great, which is very useful from what we've seen of it. It's a very good program.
Yeah. It was pivotal for us. It's what made us decide to set the company up.
Excellent. Okay.
So it was incredibly valuable. And through that, we were introduced to our business mentor, a guy called John Fox. So John has 30 years experience in the pharmaceutical industry, so directing all levels of drug development all the way from bench out to bedside and clinical trials, licensing agreements and trade sales further down the line. He knows his stuff.
So a useful guy to have on board, absolutely.
Yeah. So he was our business mentor for the IQR program, and we decided quite quickly that we wanted to hang on to him. And he's now chair of our board, and he's a huge asset to the company. So I've spoken about the chicken work and I've spoken about the food supplement work, but our ultimate goal is development of this product as a pharmaceutical product. So it's accessible to all. Anybody who needs it can have it via prescription on the NHS. But of course, to do that, it's a very long route. We have to do clinical trials. It's going to take us a long time to get.
Yeah.
So everything else sort of keeps us ticking over in the meantime.
So in terms of kind of next steps and those ultimate goals, you know, kind of what timelines are you kind of preparing for that pharmaceutical journey? And obviously you've got the launch of the supplement coming up. Kind of what other kind of next steps are you going through?
Yeah, so the first thing that we've got coming up on the calendar is launch of Ferryx.
Yep.
So that's going to be by the end of this year. At the same time as that, we're going to be starting a trial of this product in patients with gut symptoms. So it's not a clinical trial. It's just getting some early feedback on people who have, from people who have gut issues.
Yep.
So they will be taking the product for 8 weeks. They'll be giving us stool samples at the start and end as well, because, we love a bit of stool. And and giving us some feedback on their symptoms as well while they're taking it. So that's sort of the first big step for us. That can give us some insight into how the product's going to perform in a clinical trial, and will help us with the planning of that as we go into it. Because the other thing that we're doing alongside that is preparing for that clinical trial. So at the moment, we're working with clinical advisors and regulatory consultants to design our clinical trial, work out how we're going to do that. We are planning to do a clinical trial of this product in patients with ulcerative colitis, which is one form of inflammatory bowel disease. And we're looking at starting that trial towards the back of 2023.
Excellent. And in terms of going through that, so obviously you're working with kind of clinical experts, etc. Have you got kind of clinical experts that are actually in practice, whether they be in trust, etc. already? So you've kind of almost got a route to market once the clinical trials are done.
Yeah, absolutely. One thing that we've done from the very early days of this is engage with gastroenterologists in particular, people who see these patients on a daily basis, to really understand what are the problems that they're seeing, the most common things that people are asking them about, coming to them with when they're in clinics.
Yeah, no, that makes perfect sense. So what's... You've kind of been through this journey, 13 years in at the moment. You're just about to launch your first food product as a food supplement. You've then got the long journey of clinical trials to go ahead of you. But you must kind of look back and what's kind of been one of your highlights so far, or kind of what was that moment? Obviously, maybe it might be a eureka moment, but what was the moment when you kind of went, this is what we're doing and we're doing a good thing here, or kind of that moment where you kind of suddenly thought, we're doing the right thing here?
Yeah, do you know what? I think one of the biggest moments actually was when I went to a meeting hosted by Crohn's and Colitis UK. And it was while I was on the iCure program, actually. And I went along to sort of chat to some patients and get an idea of the sort of things that they were looking for. And it was a medical education event. So they invite patients to come in and listen to speakers. And they had a couple of medics talking that evening. It was a really interesting event. And afterwards, I was introduced and told people could come and talk to me about the product that we were developing. And the number of people that came over and said, where can I buy your product?
Yep.
I'd like to try it, please.
Brilliant.
And that was when I thought, wow, okay.
Yeah, that's when you kind of you're onto something, and you've already got that demand as soon as you talk about it. Excellent.
Exactly.
So what advice would you give to entrepreneurs, particularly in the life sciences space? Kind of what would your kind of words of wisdom to be somebody who's just starting out on that journey?
Yeah, I mean, again, I think one of the most important things you can do is understand your market.
Yep.
It's talk to the customers and the end users, which may be different people, depending on which route you're going down. And we've been talking to patients as our end users to find out what they really want. And that gave us some really interesting data, because we found that overwhelmingly they're all willing to try sort of a probiotic-based product.
Yep.
But nobody likes the yogurt drinks. I was quite fond of those little yogurt drinks. I mean, I can't say how particularly effective they are, but they're a nice thing to eat, if nothing else.
Absolutely.
The patients who have these inflammatory conditions will say, no, we don't want these kind of products. We don't want things that contain lactose.
Right.
So that meant that very early on, we knew that we needed to make a lactose-free formulation. so that it's suitable for these people. I mean, as a byproduct of that, we don't include any animal products in any of our products, so it's all vegan friendly, which gives us another avenue. But yeah, I think understanding your market is absolutely key. Talk to the clinicians, talk to the patients, understand what they want, and it's an ever-changing market as well. So,
and I think you're absolutely right. I think, I've seen so many pitches over the years from early stage businesses looking for funding, where they're saying things which they obviously haven't spoken to their market, they haven't spoken to their customer, because you're sitting there as in some cases a potential end user yourself, and you're going, no, that's not what I'd want, or that's not that. I don't know anybody that actually buy that. And I think that's sometimes overlooked, is that people can run away with a good idea, but you sometimes have to give yourself that balance and check by going back and just making sure that it's fit for purpose and
absolutely.
what we want.
Yeah, so I think as scientists it can be very easy, but often rather arrogant, to sit there and think, I know what people want.
Yeah, absolutely.
But you don't know until you've asked them.
And in terms of obviously kind of uniquely be based at the University of Bristol with Set Squared there, which is an organisation we've worked with numerous times and we've got a huge amount of respect for. That must have been great kind of support and kind of incentive to some degree for you to kind of get this off the ground and give you that kind of that comfort that you can do this and go forward.
Yeah, absolutely. I mean, I spent most of my career being a scientist. The world of business was completely alien to me.
Yep.
And having that support from the university and then subsequently from Set Squared has been absolutely vital. I couldn't have done this without either of those support networks around me. We won 6 months free membership to Set Squared through a University of Bristol competition.
Brilliant.
And I think that's the most valuable prize we could have won at that point. We were almost a year post-incorporation when we got that. And I think we spent a year almost sort of floundering. We had some traction with obviously the AB Agri deal, but I think we were floundering a little. And this came at exactly the right time for us. And it really helped us to focus and grow in the way that we wanted to.
And I think from our perspective, it's interesting that you made that point that working in academia and then working in business can be two very, very kind of counterintuitive kind of things to each other.
Yeah.
And I think we've certainly seen we've had obviously companies come to us funding where there are purely academics and they have no desire or will to actually dip their toe into the world of commercial and kind of dirty themselves with being business people. But where we do find people such as yourself who has that ability to kind of cross over the divide is always very reassuring for us, because it shows that the company's got the opportunity to go and grow as well as create great science.
But so without the support that we've had, I think that would have been incredibly difficult. I think particularly one of the most valuable things we've had through Set Squared is our entrepreneur in residence.
Okay.
So they are absolutely amazing. So you're assigned a particular entrepreneur in residence to work with you throughout your time at Set Squared, and they are somebody who will push you. You don't get an easy ride with them. They will push you.
And I think that's part of the battle, isn't it? Having that support network and as you said, even for them, it might be not that they know the answer, but knowing where to go. And it is the old adage of it's not what you know, it's who you know, isn't it? I think that's certainly the world of business is key.
Exactly. But again, with these kind of things, I find that it's not just the support networks that are put in place, it's the peer networks that you find as well through these programs.
Absolutely.
There's an excellent peer network through Set Squared and also through Future Space, where I rent office space. We get similar support through there. And it's that peer network of having a friend who's doing the same sort of things as you, or is a bit further along the journey, or just a little bit behind you, and you can bring together that combined knowledge and just support from a friend who goes, we're having this problem as well.
Or similarly, kind of as you alluded to before with your mentor, etc., somebody just to push you. Sometimes you just need somebody to say, or maybe they're slightly ahead of you and you go, we need to catch up. We need to, that little bit of competition, if you like, or competitive rivalry. That's all good. And obviously, kind of, you've already won some awards as well as, so can you just, I'm sure you're far too humble to bring it up yourself. So, do you want to just tell us a little bit about that?
Yeah, so the first one that we won was, we were runner-up in the University of Bristol's New Enterprise competition, which got us that Set Squared membership. After that, we won the Good Award through the Tech Sparkies, so for best use of technology to do good.
Brilliant.
And then last year, we won the That was the Set Squared Tech Expo best elevator pitch.
Excellent.
We won, so yeah, but it's been a lot of fun, and again, we've had some excellent support to get those awards.
Excellent. So, okay, so that's with these podcasts, we like to bring to life the people behind who are doing these great things that the companies that we work with, and kind of away from the 24/7 of running an early stage business. What do you do away from the office or from the lab? What are your personal interests?
Sure. So my other 24/7 role is I'm a single parent to a 7-year-old boy.
Excellent.
So
that'll keep you busy.
He keeps me busy, so my main interests are being a taxi driver.
Excellent.
And arranging for him to meet up with his friends, which is all he wants to do at the moment.
Good.
Yeah, and standing in cold fields, watching him do various activities. So
we've all been there.
It's all good fun. All good fun.
Good.
Yeah, aside from that, I wouldn't say I'm a creative person, but I can follow a pattern. So I'm an avid knitter and cross-stitcher. I'm currently cross-stitching a montage of Pokemon for my son, who is... Yeah, he's a big Pokemon fan. So
does most of that work now involve around what his interests are and what he wants?
Absolutely.
Yeah. That's
absolutely
good.
Yeah,
good, excellent. So the question we ask all of our guests on our podcast is about the Deepbridge dinner party. Apart from friends and family, because we don't want to offend anybody. Dead or alive, who would be the kind of 3 guests that you'd invite to Deepbridge dinner party, and kind of briefly why?
Yeah. So the first person that I would invite is Eli Mechnikov, who is described as the grandfather of probiotics.
Okay. Yep.
So in 1907, he was the first person to suggest that you could replace what he called putrefactive bacteria in the gut with lactic acid bacteria or probiotics. And that could normalize gut health and prolong life. So he had this big thing about the prolongation of life. He wrote a book, The Prolongation of Life, Optimistic Studies.
Okay.
And so he was sort of, the first person to champion probiotics. And I'd love to hear what he thinks about the microbiome field now.
How it's developed over that time. Absolutely. Yeah.
Exactly. So I think, that would be really, really interesting to have him there. He died in 1916, age 71, and he drank sour milk every day in an attempt to prolong his life.
Okay.
I think, 71 in 1916 is
it's not bad at all, is it? Absolutely. No, that's there must be some science in there. Absolutely. That's good. And who else are you going to invite?
So the next person that I'd like to invite is Professor Denise Kelly. So I've always found her to be inspirational. She's had a fabulous career so far, firstly as a highly successful and well-respected academic, and then founding GT Biologics in 2008. So that was a company that was set up to develop biotherapeutic products for the treatment and management of pediatric inflammatory bowel disease and other autoimmune conditions. GT Biologics has now grown into 4D Pharma, which is one of the biggest players in the microbiome space. Yep. Now it's got a portfolio of microbiome-based products for the treatment of gut conditions.
Brilliant.
She's also now an investment advisor for Saventure, which is one of leaders in VCs. So she's truly inspirational.
And somebody who's been on your journey as well.
Exactly. That's it. Somebody who's been on my journey. She will have seen all this before, done it all, and come out really successful. So I would love to pick her brains and sit next to her over dinner.
Well, I'm sure in not too long she'll be wanting to pick your brains as well. So that's good. And who's the final person on your list?
The final one, I'm going to throw in a bit of a curveball here and say this is inspired by, I went to the cinema this weekend and I saw Moon Age Daydream, which is a documentary about the life and music of David Bowie.
Yep.
And I would love to invite him to dinner party. I've always loved his music and I've always found him to be a really interesting person.
Absolutely.
And a lot of the things that came out in this film was, I thought, sort of about his entrepreneurial spirit.
Yep.
He was never afraid to try something new. And he was really passionate about what he was doing.
Yeah.
He was constantly reinventing himself. And he said in the movie, he wasn't giving people what they wanted.
Yep.
He was doing what he was interested in and hoping that people followed him. And he knew that was really risky.
Yep.
But one of the things that he said that I found sort of really relevant to the sort of things that I'm doing as an entrepreneur, he said, if you're comfortable with what you're doing, then you're not doing the right thing.
You've got to push yourself. You've got to.
Absolutely. You've always got to be trying something different and staying ahead of the game. Otherwise, you stagnate and you don't go anywhere.
Well, I don't think anyone can ever accuse David Bowie of stagnating. I think
no.
He was.
Exactly.
My favourite story about David Bowie was when he decided in the 70s that he wanted to see what socialism was all about. So he decided to live in East Berlin for 2 years.
Yes.
And when he came back and his friend picked him up at the airport, his exact words were, "Well, that doesn't work either." And then he got in the car and drove off. So that's his mind was wanting. He wants to try things and push things. So I think that would be very interesting. So that's.
And if he could bring his guitar and sing a few songs at the same time, then even better.
Absolutely. Why not? It could be entertainment afterwards. That's great. So
Yeah.
Jenny, thank you very much for your time. That's been a fascinating insight, not only into your business, but how working in the life sciences space and starting a business and growing a business really works. So thank you very much for your time today.
No, thank you. It's been great to talk to you.
Thank you. Thank you for joining us for this latest Deepbridge Discovery podcast. If there's any subjects or topics you'd like us to discuss in future episodes, then please email us at discovery@deepbridgecapital.com. This podcast was brought to you by Deepbridge Capital LLP. Deepbridge is authorised and regulated by the Financial Conduct Authority. Please note that investments discussed are both illiquid and high risk and won't be suitable for all investors and should be considered as part of a diversified portfolio. The content of this podcast should not be construed as financial or taxation advice. We recommend investors seek appropriate professional financial advice. Any views expressed may no longer be current and may have already been acted upon.